Well, that's true, and as a matter of fact, I think it would be considered malpractice to give a patient niacin without telling him. You don't play tricks on people. You don't give them niacin without telling them, because you can have some terrible consequences just from the fear. Let me give you an example. I had a internist from Detroit came to visit me in Saskatoon many years ago, and he was so impressed with what he saw that he decided never to refer any more of his patients to psychiatrists. He said he was going to do it himself. One day he forgot to tell his patient that he was going to turn red on niacin. The patient went home, picked up his 2 pills. They turned beet red, become frightened to death. He immediately phoned up the nearest hospital.
We'll let the phone go through. I'll have to cut that out. So we were saying the physician who forgot to mention.
Yeah, he forgot to tell his patient that he would turn red flush with the niacin. When the patient came home and took his first pills, he developed his usual typical first flush. He became frightened because he hadn't been told it was going to happen, and he phoned up the poison control center of the closest hospital in Detroit. And someone answered the phone, and he told them what was happening. So they said to him, "My God," they said, "you have been poisoned by niacin. You better get down here immediately." They sent the ambulance to pick him up. You can imagine this guy's fear now. But by the time he got to the hospital, the flush was gone, and he was feeling fine. He should never have been allowed to take that without knowing. That's very important. Now, once you tell him that it's going to flush, it depends how you do it. If you don't like niacin yourself, you'll tell your patient, "Oh, I wouldn't give you that stuff. It's horrible. You're going to turn red. It's going to drop your blood pressure." And you're going to frighten your patient so much, you'll say, "Well, I don't want to take it." But if you understand what you're working with, you can say, "Well, don't worry about it. You're going to turn red. It'll last an hour or two. It'll be hot and itchy. It won't hurt you any. It's a natural reaction, and every time you take it, you'll flush less and less and less." So that's the approach that I use. In terms of danger, the only potential danger is that sometimes they get so frightened that their blood pressure drops and they might fall. This has happened in 2 or 3 cases, I think, in the past 50 years. So if the patient is concerned, they take it sitting down, or else you start with a smaller dose. In terms of there's no danger, whatever. I've been taking niacin for 50 years. I don't flush anymore.